Dr. Naveena Muralikrishnan. Two, yes. Yes, please go ahead.
So good evening to one and all presenter. I would like to present a case of colloid cyst manifesting as a third nerve palsy. So a 15-year-old girl presented to us with complaints of drooping of right upper lid and pain in right eye since 3 days. She was apparently normal 1 week prior to our presentation, after which she had symptoms of vomiting associated with headache, for which she was treated as acute gastroenteritis by a local physician. There was no history of defective vision, transient obscuration of vision, or no history of fever. On examination, she was appearing weak with mild dehydration. Her vitals and systemic examination was normal. Her visual acuity in both eyes was 6 and she was able to read all plates in Ishara-stat. Her anterior segment examination showed right eye complete ptosis, which on elevating showed downward and outward displacement of the globe. Her conjunctiva, cornea, and anterior chamber and iris were normal, but the pupil was dilated and fixed in right eye. Extraocular movements of right eye showed elevation, adduction, and depression limitation. Left eye anterior segment examination was normal, but the fundus examination of both eyes showed established disc edema. With the presentation of unilateral oculomotor nerve palsy with both eye disc edema, a compressive etiology was suspected and MRI brain was advised. MRI showed a poor enhancing mass at the level of foramina of Monroe, which was causing obstruction of CSF flow from the lateral ventricles to the third ventricle, causing dilated lateral ventricles seen in the coronal section and sagittal section, suggestive of colloid cyst with obstructive hydrocephalus. In addition to it, there was lateral deviation of right globe, which was suggestive of third nerve palsy. Along with it, there was prominent nerve sheath complex and periventricular interstitial edema was seen, which was suggestive of increased intracranial pressure. Hence, the patient was referred to neurosurgeon, where she underwent emergency endoscopic excision of the cyst, which was uneventful. On POD 15, there was partial improvement of ptosis, but she had persisting headache, for which CT brain was advised, and there was communicating hydrocephalus. Hence, she underwent shunt surgery. On 1 month follow-up, there was complete resolution of ptosis in right eye, and there was normal pupillary light reaction, and her extraocular movements were full and free, and both eye there was resolved disc edema. Hence, I'll come to a discussion where the colloid cyst is a slow-growing benign neuroepithelial cyst, which most commonly seen at the roof of third ventricle. This accounts for 1% of all intracranial neoplasms. They are usually diagnosed in the third and fifth decade of life, mostly being an incidental finding. Occurrence in the pediatric age group is very rare, which leads to a diagnostic challenge because of its atypical and aggressive initial presentation. In a case series published in 1980 of 33 cases, all of them had bilateral papilledema, and 15 of them presented with progressive increased symptoms of increased intracranial pressure without localizing signs. Among them, one patient presented with third nerve paresis. And another case series where a patient presented with headache and double vision due to third nerve palsy as the initial case presentation. However, none of the literature had a definitive localizing cause for compression of third nerve palsy in these cases. And also, we found that transient oculomotor paralysis can occur in the event of acute rise in intracranial pressure without localizing cause. Hence, I like to conclude that third nerve palsy can also present as a non-localizing sign in following space occupied lesion with acute rise in intracranial pressure in the absence of uncal herniation or direct midbrain involvement. The involvement of third nerve palsy indicates the severity of the disease and the need for early detection and prompt treatment. Thank you.
Thank you. It was well presented. I have 3 patients with colloid cysts, and it's been several years since they are on observation. So none of them has been symptomatic. So this was really sort of enlightening to see how fast it responded. How fast it manifested, and then it responded to treatment. That was interesting.